Before dawn lights up the horizon, staff at Anan Health Center have already flipped on the lights in their workplaces as they begin a busy day, meeting the needs of their health guests. After a restful night, a glass of freshly squeezed juice boosts the system with its life-giving nutrients. The first morning of the program, Anan administrates a complete blood test for each health guest. The following mornings, the guests are each scheduled to have their blood pressure and pulse evaluated. This way, a record of their health status is kept throughout the program. The relaxing atmosphere, beautiful scenery, warm sunshine and fresh air causes one to immerse himself in the beauty of nature. Morning exercise is the activity which awakens every fiber of the body and motivates it to interact with nature. Let's go! Anan Health Center is situated in the midst of a lush, green forest away from the hustle and bustle of city life, away from its pollution and stress. It is an ideal retreat where we can rest our weary bodies and minds. After consulting with the doctor, each health guest, depending his or her needs, is advised regarding diet. Some are instructed to go on a juice fast for detoxing the body, while others are allowed to feast on scrumptious meals. Wow! What a breakfast! Can't wait to dig in! Anan Health Center promotes a nutritious, balanced vegetarian diet. Here is a healthy tip to remember. Eating your raw foods first improves digestion. The staff at Anan not only seek to provide the best diet for the physical body, they also care for the spiritual needs of their health guests. A devotional talk is scheduled soon after the delightful and nutritious breakfast. In addition, we as health guests have the opportunity to learn skills and tips in preparing gourmet dishes. These delicious, wholesome recipes can then be prepared in our own kitchens. Alright, it's showtime! Another healthy reminder from Anan Health Center. Even when using moderate amounts of oil, salt and sugar, we can still make tasty, healthy food. Wow, look at these scrumptious dishes from our cooking class. Who said vegetarian food is bland and boring? Carefully and creatively prepared vegetarian food can be not only healthy and nutritious, but enjoyable to our taste buds too. Educating on prevention is better than curing after diagnosis. Morning health lectures provide the guests with a correct understanding of disease and how to apply simple natural remedies for preventing or curing disease. After learning about making healthy choices, it's time for lunch! Let's check out the menu for today! Besides having a balanced diet, another important factor is to use variety and creativity when preparing everyday dishes. This will not only be pleasing to the eye, but tasty and satisfying for the body as well. Practicing the 8 laws of health that Anan promotes is an experience of learning and change. However, if we are eager to learn and if we use food items and resources readily available to us, we can enjoy healthy, happy lives. Come, let's learn together! Anan customizes its health program to fit the unique needs of each health guest. The program is run according to the New Start principle, which are nutrition, exercise, water, sunlight, temperance, fresh air, rest, and trust in God. Those who live in the city commonly suffer from physical and mental exhaustion. ANAN offers treatment programs geared to boost the immune system and rejuvenate our bodies. Following a natural treatment plan avoids the side effects that often come with prescribed medication and also ensures lasting results. Various natural remedies include hot foot bath, steam bath, fever bath, infrared therapy, colonic cleanse, and Swedish massage, etc. Along with the treatments, the physician administers a medical evaluation and consultation for each health guest. Throughout the program, each health guest will benefit from health progress reports and continued consultations. Another refreshing experience is in store for the health guests. The breathtaking sights, curious sounds, and tantalizing smells of nature. The hands-on gardening experience of planting, weeding, and harvesting is an activity that helps boost our immune system as well as give us satisfaction. These quiet moments help to relieve stress by allowing us time to slow down, to reflect, and to do some self-evaluation. As the saying goes, breakfast like a king, lunch like a queen, and supper like a pauper. A small simple dinner provides nourishment, yet does not overtax the digestive system during the night when the body is trying to rest. Relaxing the body mentally, physically, and spiritually is the only way to truly recharge. At ANAN, staff members join the guests in light-hearted singing and educational movies. It is an enjoyable socializing time. Sleep plays an important role in the restoration of our body, but many often overlook this health principle. Because ANAN Health Center values the importance and benefits of adequate rest, the staff provide each guest with comfortable beds and well-ventilated rooms to ensure quality sleep. ANAN encourages all to develop a habit of getting to bed early. The hours for the best quality sleep are between 10 p.m. and 2 a.m. These are the 4 most precious hours of sleep because it is during this time that melatonin is most active in the body. In fact, this is what we call beauty sleep. Well, today I've learned that in order to change the quality of our lives, we must begin by changing our daily habits. The healthy lifestyle ANAN promotes is truly effective. Now, it's time for me to rest. Good night, everyone.
Hi, good afternoon, everyone. Welcome to our COVID-19 forum, how to learn how to live the new normal life during this endemic time. I'm Dr. Puazani. Currently, I'm the Health Director for PEM. Welcome each one of you to join our COVID forum. Really thankful that our speaker today, we have 2 very senior and very experienced doctor. So I would like to thank them to take this opportunity to use their precious time to share about their knowledge on health and to let us know more on this COVID-19. So first, I would like to introduce our speaker today. The first speaker is Dr. Lai Nai Lang. He is the respiratory consultant in Melaka Pantai Hospital, and he is also the elder of Melaka Church. And the second speaker is Dr. Liu Hong. He's the lifestyle medicine physician and also the co-founder in Anet Healthcare. And he's also the elder of Tampin English Church. Really thankful for them to take this opportunity to share about the knowledge. And I would like to introduce the host for today, two young lady who is also working in Anet Healthcare. So the first one is Sing Ru. She's the administrative of Anet Healthcare. And the other host is Elvina Yo. She's the administrative for our Anet Healthcare training, for the Anet Healthcare training. So before we start, shall we have an opening prayer? Let's pray. Okay, let's pray. Our Heavenly Father, thank you so much for giving us this time to have this moment to learn about COVID and how to take care of our body. And God, please be with us, and may this sharing and let each one of us know how to take care of our body better and help to fight during this endemic time. And may God bless each one of us and also bless the internet connection and each and everything. And may God bless us. In Jesus' name I pray. Amen. So lastly, I also would like to thank you, Pastor Bernard from Sabah Mission. He's also the Sabah pastor in KEPAYAN district, and he's also running the LIST ministry. And this COVID forum is a collaboration with the Anet Healthcare, LIST ministry, and also the Loudways Media. So now I would like to pass the time to our host for today.
Hi, thank you so much, Dr. Phua, for introducing us. We are happy you all can hear us. You all can hear us, right? Thumbs up, please. Okay. All right. We are so happy to be able to... A bit louder? Okay. We are so happy to be part of this. Yes, I can see that. Good. So we are so happy to collab with the PMM Adventist Health Ministry in doing this COVID forum. And we are so happy to have the doctors with us. So we have plenty of questions we can ask. And we're also wondering, as a part of a person that we are also involved in this whole pandemic of COVID-19, we have some confusions we want to clarify. And that's why we are here to ask Dr. Lai and also Dr. Lee. So I believe that we have been fighting with this COVID-19 for almost two and a half years. And recently, Malaysia just changed and transit to the endemic phase. So we are not so sure that people around you are right now, maybe they all have some history of COVID-19. So there's something that we need to clarify. So today, we like to ask Dr. Lai first. Okay, some of the questions, and I hope that the audiences that joining us, if you have questions, you can put it in the chat box. Okay, we will have a Q&A session at the end of our forum. Okay, so Dr. Lai, are you ready?
Yeah, thank you for young MC. Just now Zining introduced us as a senior. That means another word for old. But we all survived the COVID. So yeah, old warrior. I think everyone had to congratulate everyone who tuning in at this afternoon. You all can hear me, right?
Yes.
Okay,
we can hear you.
Yeah.
Okay.
Yeah.
So Dr. Lai, we will head in directly into the topic. Is it okay?
Sure.
Okay, so we will start out with our first question. Our first question for today is, as we have heard that just now it says that many people around us, they are suffering from COVID, and it's so common, especially now Omicron, is the dominant strain circulating in Malaysia. So we'll just talk about Omicron. How long is the incubation period for this Omicron variant? And if a person completed the 7 days quarantine, will they still be dangerous and able to transmit this virus to another person?
Yeah. Okay. Actually Omicron is a blessing in disguise, because if you wanted to get COVID, you better get it now rather than last year. So because now I just came back from hospital, it's flooded with visitors because somebody say, no, DG say can visit already. Everybody visited, so the nurses cry, it's too confusing. But anyway, we actually compare to the previous Delta, the Gamma, and all the Alpha original ancestor strain. This Omicron strain, the incubation period is actually 2.8 days only, 2.8. So before you realize it, you already passed to 9.5% each one. Last time the Delta was given to maybe 1 to 4 like that, but this one is faster, more than 2 times, 9.5 lah. So the incubation period is only 2.8 days before you realize the symptom, and the symptoms are quite mild as well. So I have patients who told me, I mean, after COVID, they took some in the family, some of them have loss of taste and loss of smell that was mainly caused by Delta. Then some of them do not have fever 1-2 days, sore throat, cough, runny nose. Those are mainly caused by Omicron. So Omicron is actually from South Africa. So the variant developed in the people's body, very few vaccinated. So they change into a bit of benign one. So it lasts longer. Hopefully it took over, like BA1, BA2. Hopefully it took over, so became milder. Pending, their combination and all, the BA1, BA2 become XE, but hopefully they won't become worse. But it's still actually more serious than influenza. Last time, actually, because this pandemic is a bit a noisome pandemic, like in the Psalm 91. Noisome in the sense that people know a lot, and people know half, and people do not know, still they talk. So a lot of news coming around, so it's very noisy. So sometimes we lost the signal. That the real study and the thing that hasn't come out is like ever learning. But the thing that we it's like actually the scientists say, become milder because then it can survive longer in the host, like not like Ebola, then they kill the patient and then die off, like SARS is very lethal. But we also had to think maybe it's not just that, it's probably God's mercy to tone down the whole pandemic, so that actually though it goes slowly, hopefully it just won't become more serious, but it's still more serious than the normal influenza. The normal influenza, the death rate is 0.1%. This one is about like 0.75%. So last time when we have influenza, any viral illnesses, a lot of people, we don't care, we don't talk. Yeah, still was many old people after the flu, they had a heart attack. Many people after the flu, they have this sickness that originally had, then become destabilized. But nobody bothers, is not interested, you see, because influenza happened here and there, here and there. I'm sure there were people who has, gone into the brain, encephalitis. There are people who have, heart infected, but nobody studied it, nobody published it. But now, because everything concentrated in the new virus, it came into the humankind, and then there's no immunity to it. So the old people also get it. If something that happened in 1918, like a flu, then the old people has the immunity, they usually won't be affected. But this is totally new. So even the old people do not have immunity. So everybody, just the scale of the invasion and scale of the thing, so it's something shocking. So everybody started panic and looking at it. But it's another virus, but it's something new. So just have to remember this one, 2.8 days incubation period. Whether you ask after 7 days, the other part of the question, after 7 days, it is a rule, it is a generalization. Just like what do you call that? If you see the jungle outside Anan, you have a forest. But when they say the forest is like that, doesn't mean every tree had to be the same. So when you say 7 days or 5 days, quarantine 7 days, then the virus, there will be a little bit of virus left inside your cells. You have so many cells in your body. So depend on which one clear it faster. But after 7 days, your small amount of virus actually mostly not infective, and it might not infect a lot of people, in the healthy people. But if you pass by the immunocompromised people, those who have sickness, you will not know which one had it. You would think freely that you might have 7 day pass already, you might not infect the person, but the person might have leukemia, the person might have other cancer in their body. You can still pose dangers to certain people. So it's just not specific. Generalization is probably say, after 1 week you are safer, but it's a degree of safety depend on the seed is the virus that you produce, but the soil are the people's body that you come into contact with. So maybe had to go by case basis. Yeah.
So in other words, you are trying to say that those who are having low immune will be more like tend to have this sensitive, I would say
They
sensitive.
will stay longer in their body. That's how this Omicron came about, because the patient in South Africa, they were not vaccinated and they couldn't clear the virus. They got Delta, and then the thing changed, stay in the body for very long, and then it came about to this Omicron. Yeah. So
Okay.
sometimes it stay in your body very long. It's not that because it can infect or not, because a lot of people's immunity, they will receive it and keep it going. Yeah. So you will not know when you say it cannot infect, that means you are blanket statement. You say all the tree are the same in the forest. But when you say, when you meet a certain tree that are vulnerable, when you meet certain people that are special or different from others, then actually to that person, you can infect them even after 1 week. Yeah.
Then
And somebody,
be safe.
How long
you
then
depend
is
on your
considered safe?
soil. That means your body have no
Our
like very
bodies.
healthy, no other sickness. Usually you can clear in 1 week, but your bodies will still send signal that you have something inside your bodies. That's why they started to have the immune reaction. That's why you have all the long COVID, all the the cells still dying off because the viral body is still inside the cell. The cell recognize it. Oh, this one may be still present, even though it's dead virus. That's why you do PCR, it might be more than 35, more than 40, but your body may still recognize it and started to attack it in a small scale. Yeah. If you're healthy.
Okay. So whether it's our own soil or the other person's soil, both also have to be careful.
Yeah.
All right.
Okay. So besides talking about this, many are also wondering, can a person actually get COVID twice in a month? And whether with the same variant or different variant like Omicron or Delta, or how soon can a person get COVID again?
Okay. Recently, the news about the Dutch healthcare personnel got it within 20 days, but they discovered that there's two different strains. The Delta first she got, and then the second time around, she got Omicron. That time, second time around, she got symptom. Okay, so they swap both, and then they have the genomic study. They found that first one she got was Delta, second one was Omicron. I think certain places where the Omicron rate is so high, sometimes it's inevitable. So they say you might get something like flu. You got flu and then you can get flu again. So last time when I was in Singapore taking care of H1N1 patient, within about 2-3 weeks, I got twice H1N1. So I took care of ICU. So first time was not much. Second time was quite bad. So I had to take medication. So I think it happen because your immune system have no time to react yet, to recognize it well. It's something new, is your body hadn't met before. So your natural immunity might might not recognize Omicron second time around, because Omicron can escape a lot of immune cell that is generated for the Delta. But though it's not so serious, but you might get it, and then it's a bit rare to get second time in a short span. But after 2-3 months, your Omicron immunity also will wane, and then you might get another Omicron. Hopefully, it's still Omicron. It's not something new. So you can get twice. You can get short time. Especially in high density setting where you take care of the patient. Let's say you are healthcare personnel, you might meet it again and again. But open air, I think like normal people usually a bit rare unless you are in those situation where you get to be exposed again and again. Yeah.
When you had already the immunity for the first time, but you also have the possibility of getting the second time, but it's not so, I would say, so high the risk right?
Not so high the risk. It's just that when you how do I say, if your body reacting, you might get sicker, because the body second time will know that it's something similar, but it's not totally the same. You might get more symptoms to alert your body to work up, and I mean, you won't be that sick if you are vaccinated and if you got the first time around. But the natural immunity probably lasts about 3 months. So that's why they still advocated to get booster. You get vaccinated, it's better than not, because you have some backup. Just we don't know how healthy you are. So some people, even they get so many times vaccine, they still cannot elicit the immune response. It's basically the soil, elderly people, they have sickness. Even you give them a lot of booster, they might not generate the required immunity. Yeah.
So just now what you mentioned is that if a person gets Omicron, then the person may get Omicron another time, but the symptom may varies. Like it may get worse, or some people will much milder.
No, because because at this juncture, the timing that we are in now is easy to differentiate. Even you don't do genomic study, you can ask the person, last year you got it, right? And second half last year, most likely Delta, you loss of smell, loss of taste. But this time you get it, you don't have this symptom, you can a bit safely say. And last time in the hospital, we swab PCR, we have the S, N, and E gene, we can show on the result. But this time when we swab everybody, mostly the N and E gene are shown, the S gene drop off. So we know this time are mostly Omicron. This time is conveniently say so if you continue from now on, it's still Omicron, then fine we know that when you get 2 times or 3 times, it's still Omicron. But we will not know that well if you do not do the genetic study further down the line, because there might be new variant, we do not know.
So how long actually does our immunity will last in our body?
Okay, there are different type of immunity. The one that can be measured is antibody. Antibody will be about 3 months plus, like that. But even the best vaccine probably 6 months, that kind of thing. But there are some unseen part, the T cell and all those things. They are basically the train in our body. Like in the children, they have very big thymus. It's a gland that reabsorb after when you are big. So they have backup. That's why they have got more reaction after they got the COVID. They have some multi-system inflammatory. If their immune system overdoing things, whipped up a lot of reaction. But in adult body, they also have some T cell. They are not. This virus is not like HIV killing off your T cell. So your T cell is still able to learn very long, maybe 1 year or further. But they are still waiting for more information coming in. But the thing is, like, T cell a bit difficult to measure. It's more like quality than quantity. So, but if you are having some sickness, of course, any immunity will be shorter. You have some sickness, leukemia, you have some HIV, you have some chronic diseases, or you are, just because you're older, you might not keep the immunity very long, and you might not mount the response very well. So
Okay, so it varies for different people.
Yeah,
so
everybody different.
Okay, so move on. So now we say that recently we have many friends that got Omicron, and then after when they recover, then many complain saying very tired, they still feel breathless and all this. So what are the causes that some people will have this post-COVID syndrome, and when does long COVID actually begins, and what are the symptoms of long COVID?
Okay. When you meet a viral illness, any viral illness, like dengue, chikungunya, or even this everybody interested in this COVID. So when your body made it, you can have 3 things, the after effect. One is the effect of the virus coming into your cell. Basically, the virus want to enter your cell and make your cell as a factory for the offspring. So it's like Ponzi scheme, right? Like Facebook, you want all the people to like it. Then you join the Facebook, you sell something, then everybody, because want to be the same group, same club, they buy your t-shirt or whatever. So the virus is like that, using your body as their factory, right? To make more anak all come out. Okay. But the thing is, your that is one effect from there. So probably last about, like, when you say 7 days too short, maybe about like sometimes it can last about 6 weeks, 6 weeks, and then after 6 weeks to 3 months is in the middle. After 3 months probably will be long COVID already. Then this is one thing the virus does to your body. The second part is sometimes people have a very serious COVID. They might get some medication or treatment. They might get some steroid. They might get some immunomodulator. So the effect of that post-COVID thing may be due to all this side effect of the medication. They can sugar go very high appetite, very difficult to sleep, because steroid also will make you gone into the brain, and then no choice, because of life-saving that time. And then some immunomodulator, you have a very long kind of autoimmune disease. Autoimmune is like when you take off the steroid, your body is attacking yourself. Okay, and some people have scarring the lung, organizing pneumonia, so their oxygen will be low. You've seen a Malay teacher using a gas mask and teaching student, right? Some of them, the air pipe will go very tight. Some of them have already a tendency of reactive airway. So these are the second part that can cause. The third part is actually you have some sickness which you didn't know, and then the COVID, I must say, brought it up. You probably have asthma before, and then this one make your air pipe more sensitive and tighter. So I have a lot of patients had to use inhaler after that, but they might not need to use the steroid to take through the mouth, but they still need to use inhaler to deliver steroid into the lung. So to open up the air pipe and clear up the inflammation. So they may need it short term, but hopefully it won't last longer. But in more than 3 months, sometimes a lot of people have this brain fog, the more anxiety, and a lot of people have some thickening of blood in the blood vessel, inflammation. If you get COVID, the risk of myocarditis is 40 times higher than you get myocarditis from the vaccine. Okay, and children have those, they'll fight too much of the COVID, so they have some skin changes on the toe. They have heart inflammation. So all those things, it's like when you have no choice, you meet the virus, you breathless, your heart inflame, and then your blood become thicker. But when you get vaccine, it's a small rehearsal. Small rehearsal meaning you might get breathless. Some people easily may have blood thicken, may have some inflammation in the heart. But they are rehearsal, the drill, the training, the practice before the real concert, right? Before the real concert, you want to have practice. So, but the stage down, schedule kind of reaction. After that, when you meet the virus again, you have the army, you have enough antibody and fighting to meet. So this long COVID thing is like our body trying to clear your any vestige, any sign of a virus still in your body. But the people might get a lot of effect from there. But I think it's like chronic fatigue. You need to think of it, or sometimes it's sometimes overburden. They're like what you call depressed and anxiety, and all those things will come together. Something that they might not have trained well. Now that's why I think the second part, Dr. Lee's part, is important, because you need to keep your body healthy. You need to make sure you don't have all this, even though you are young or old. You don't have something that some ticket for the virus to something that the virus will knock off something that you have to take care. You take care of one thing is enough, but if your body had 2-3 things to take care, heart issue, something that you do not know, then you'll be more complication, and everything you will blame it to COVID. Or just like last time, a lot of people who hardly come out to check with their doctor, and then after their vaccine, they got heart attack. Then people thought they started to say that it's because of vaccine. A lot of things maybe we don't consider properly our health earlier. Now is the time we need to know, not only because of COVID. Normal day, we need to take care of our, health, our heart, our, lung, our kidney. But now you started to see everything, then you will say, oh, this one maybe I got long COVID. But COVID is so common, you see. Everybody has something, doesn't mean it's because of COVID, right?
That is so true. In the sense that I had Omicron. I think I had Omicron before. I was diagnosed, I think it's in February, around that time. And the symptom is pretty like a normal flu. It's like just a very light fever, and then it's just one day, maybe just 1 or 2 days, and I have a very bad sore throat. But all these kind of things, right? You cannot really differentiate which one is you're having a flu, common cold, or you're actually having COVID. So this is probably one of the dilemma that we are having. Like whether we are COVID, we should quarantine ourselves, or we just like it's a normal common flu, so we can just work. We still can work.
Yeah, because you're healthy. Basically, you're very healthy. There are people don't bother to test now. Even the Malay, among the Malay, the parent. I mean, I had not kids, teenagers admitted. But the parent told me they don't bother to. Their whole family got COVID. They don't bother to report on the mice, etc. Everything is like, because if you are healthy, you will sort of quarantine, in the sense that quarantine put a prophecy that you might quarantine in your own eye people look at you, they say they are not quarantine. You self-perceive quarantine because people so fatigued, so burnt out, so locked down, and like so pandemic anxious, they are overburdened. But so the person who are healthy, actually they will say don't test, or just like now, even your close contact, you have no symptom, they don't isolate you anymore. That's the latest from the health ministry.
Yes.
But not every time you get cold is because of COVID. Actually, because it's just simple thing to say that other virus, other germ also, they're not taking a vacation, not taking a leave, not because of COVID there. So probably I take holiday. But just that we are more conscious with the mask, everything. I think we are less getting all the influenza anymore because we are using the mask, block off everything. So the mask is a very important thing. Sometimes we wear the mask is not because we are protecting ourselves. We are also protecting others because you do not know the people who pass by you are the people who are sick, who are unknown to have some sickness, and you don't walk in their shoes, you will not know how difficult their life. Everybody have a story behind. So sometimes you say, I throw off the mask, but you're doing a mask, or it's also considerate to others. It's also virtual to take care of others. You don't breathe the scent. I mean, if I get the air from him or her, I might not have any problem. But if he get it from me, there might be something, And I keep myself healthy because I want to take care of more people. So even if the government say you want to take off, I still would consider, twice now. Because I don't want to get sick so that I won't be able to do a lot of things. I won't be able to take care of others. And I don't want to pass it to others as well. Sometimes it's like that, yeah.
Yeah.
But testing, last time, because the influenza or pre-COVID, long time back, testing is not so convenient. There's no saliva test for influenza, respiratory syncytial virus, adenovirus. Now it's just fast kill everything, because it affected so many people all over the world. The Western and the developed countries started to, devise, invented all those tests. So last time, there were virus flying all around, but nobody paid attention because it was so mild. Now this time, you get another cold and cough, you might not be COVID, but you can test to make sure yourself, because over the time, hopefully this thing will just fizzle. It may become another influenza kind of thing, but the fatality rate is still higher than influenza. Influenza is 0.1%. The fatality rate that means in 100 you might get 1 person die, especially the elderly. This one is the Omicron strain is 0.75. The Delta is higher. Omicron is 0.75. So it might come to 10 times or 7-8 times more fatal than the influenza. Because something new. Influenza is something very old. But last time we never report any news say, somebody has a cough and cold, flu, and then after 1 week, 2 weeks, the father died of heart attack. Is it related? But actually it was related, but nobody bothered. Nobody pay attention. But now everything is so scrutinized. So any virus come inside our body have a response. But after 6,000 years of degeneration, our human body not that good like before, like Adam and Eve. So sometimes they will cause havoc to ourselves. So sometimes the thing that we have to bear because it causes havoc. I mean, the usual time, that's why when the patient go to check their heart, when they run treadmill, then they know that they have some blockage. They only started to eat well. But I don't think that's the wise way. You should eat well first. Then you meet any virus. Let's say that this COVID is not the last time. Another pandemic, you are lucky. Another time, if your body is healthy, your immune system not that overworked, you won't be like autoimmune. And then you tone down and you have some natural way and to prepare well before the crisis, not even any pandemic. Okay, any crisis, then your body will bow well for that.
So will you advise us if we have a bit of symptom, we can go and do our test, the self-test? Even you think that it's just common cold, but for the sake of...
Yeah, by the time 2.8 days, the incubation period, you have the symptom is the peak already, 1 day or 2 day already. So as you grow older, let's say, that's why now you have the antiviral, you see. So the antivirals are for people who, from the Pfizer, the Palosik, they had to be taken within the first 5 days. And when you are still okay, you don't need oxygen, but you have the risk, like say you have 2-3 diseases, or you're obese, you're elderly, there's some scoring point, and you might progress into certain complications like category 3, 4, 5. Then those antivirals for you to cut down the replication, and then you might reduce the transmission as well. But by the time you have symptoms, you test already, probably another 2-3 days, you will just go off. Hopefully you won't pass to people. I think the basic thing, the the so-called wearing masks and also be careful distancing. Those things, if you do, if you knowing it, then it will help you to do all this. Sometimes people will be just careless, and if you don't test, even because if you test, even if it's negative, you might still be having it. You see, those things are not so accurate. Yeah.
But if because sometimes common cold and COVID is so similar now.
Yeah.
And for laymen like us, we cannot identify which one is common cold,
Yeah,
which
it's better
one
to test.
is COVID. So better is just if you have symptoms, just do a RTA.
Assuming you have
test.
COVID.
Yeah, because because they are at least this is not this virus. There are other virus, or your allergy, you have something. Used to be like, let's say we want to say a rule for everybody. It's just like you're looking at the forest. Everybody has this runny nose COVID at this time because it's so common. But when you're looking at each tree, they are different. You see, you might have allergy when you get up in the morning. You might have runny nose, but it doesn't mean that every day you got COVID.
Right.
So no need to be so kanchong, they say. If you have a bit of sore throat, I got COVID. Calm down. We can try to reason first. But be careful, just wear all the precaution methods.
Yeah, because COVID is a global problem, okay? The response and the rate in every country is a local issue. But how to deal with it is your personal, individual. I mean, of course, you do all the best. You have to vaccinate, but at the end of the day, your body, let's say, healthy is not because we think we are healthy. But basically, if it is a fact that you are healthy, usually you will weather through it. You will weather the storm. But there are people who are not so lucky. Actually, you see, because I tend to be biased, because in the hospital or in roadside, you see many people that the world is a Lazarus house. That means there are more people sick. I mean, at least to the one that in my side, I can see a lot of people sick. They cannot afford COVID. They cannot afford influenza. They cannot afford even a dengue. They might die because of dengue. Just something tip over, is it? Something, or your parents. You will get to that age as well. So it's not like always take it easy, but at least you need to see, you need to check. That's why you cannot WhatsApp the condition and ask people to know what is it, because everybody is different. We had to deal with everybody, because there are people who look after the whole forest. There are people who have to look after the tree. If you listen to all the statistics, how many percent, but if you get something bad, COVID or anything, you are 100%. For you are 100%, isn't it?
Right. Okay, so thank you, Dr. Lai. But we head back to just now talking about long COVID, because we didn't finish there. We talk about how long does actually long COVID last. You say that after 3 months, then the person will enter into long COVID, right? So how long does this long COVID will last, and is there any treatment for them?
Okay, the caused by so many things. Like I said earlier, that it can be the slow, prolonged viral effect. It can be because of the medication, the treatment that the person received. It can be because unmasking of originally the disease that somebody had, just didn't bother to check, and then after COVID, the symptom came back. It might be related to COVID. So it depends. When you go through the let's say 6 weeks to 3 months, some people we will check the lung function. Some people will do a scan to see whether any remaining scarring. Some people have to do the cardiac workup assessment, see whether there's still some some inflammation. Because last time during the original virus in Wuhan and also the Delta, the first week usually typically will say the viral effect. Then the second week will go into a pulmonary effect, because the Delta, the incubation time was about 5 days. So then they will go into a cytokine storm. That means the body will, attack itself, because it's like, Second World War, maybe when that time the Russia cannot fight the Germans, so they will scorch the village. They will burn off all their villages, scorch policy. So the body started to attack something that been infected by the virus. So this kind of process is like, a lot of inflammation. So cytokine storm can go slowly. I have a patient who, like you, February got a COVID, but he smoked and he got a heart failure. And he came back recently in April, and his oxygen, when he moved a bit, it was 80+%. So there's lots of small blood vessels at the end of the lung has get thrombosed. Their blood vessels become thickened. There's some on top of his heart failure. on top of his bad lung because of smoking. So a lot of people, they have this residue effect, remaining effect. So at the end, we have to evaluate and assess, see how long it can. Usually, if you are vaccinated, you are having it less severe. So categorically, we can't answer how long would it last. Everybody different. Some people will do a lot of self-help or check Google and see what else they can do. Some people will go into a lot of herbal thing, but just that be careful. Hopefully it won't end up to cause another condition, because I think you have to have a cheerful heart. Cheerful heart do good like the medicine. I think it's better medicine. So I think the second part where Dr. Lee tell us, I think those are the more important to lessen your chance of having long COVID. Some people are not long COVID, they are lone COVID, alone. Nobody understands the lone COVID. Some people don't know what COVID put in front because they don't know, they're confused. It's a confused COVID. Okay. Some people they at the end they will hook on to COVID because they remember there was one COVID before they kena. So after that, all the problem is related to COVID. It's like that. Yeah. So I think we not to be put down the word too early. I think everybody had to be assessed differently. So then there might be a ray or light at the end of the tunnel. Yeah, for them.
Thank you so much. Thank you so much for the great input, Dr. Lai. And like just now we have mentioned some of the issues, and then I think some of my family also had this COVID, and my dad also probably have some issue with like symptoms after actually had long COVID. So eventually, everybody is different, so nothing to be so what do you call it, panic about. So you have to see case by case. Okay. Most importantly, we maintain our mentally is healthy and make sure that we are cheerful. So now we like to go to Dr. Lee. Yes, thank you so much, Dr. Lai.
Sure. Welcome.
Okay, if you have any question about or other things that you want to ask Dr. Lai, you can put in to the chat box. If you are watching from Facebook, you also can put it there, so we can ask Dr. Lai the question in the Q&A session later. So Dr. Lee, are you there?
Yes, I'm here. Can you hear me?
不能够用 laptop 吗？那个他们听不到我讲，所以用我的 phone。
Yes, I'm here. Can you hear me?
Yes.
Louder? Can you hear me?
Yes, we can hear
Okay,
you.
very good.
Okay, so Dr. Lee. All right. So we just
Yes.
have a few questions here. We want to ask like what we can do if we are quarantined at home with COVID, and is there any home remedies? We talked about just now, Dr. Lai say that if we have about all this physiology anatomy about understanding about COVID, so we just want to know, is there any home remedies or treatment that we can do to ease the symptom or speeding up the recovery process? If we are
Yes,
having COVID.
Sinru, there is. Maybe let me share slide. So, okay. And we will proceed from there. Are you able to see my slide?
Yes.
All right. Now, when we talk about COVID, Dr. Lai has mentioned about the viral part of it. And generally, we find that in this COVID, we have our immune system that will handle the virus. And it is actually the innate immune system that has all these cells that you can see here that does the handling of the virus that comes into the body. And especially we have two cells. One is called the monocyte and one is the natural killer cell. So when we talk about natural remedies, what I'm trying to, or what I want to discuss here is actually some of the studies that has shown that certain of the natural remedies can help us to build up our innate and also our adaptive immune system, right? So to be able to select certain, whether it be supplements or natural remedies that will stimulate or that will boost the immune system, right? To produce interferon. And interferon is actually has an antiviral property. The other thing that we want to talk about in natural remedy is that we will want to try to arrest or decrease the viral replication taking place in the human system, right?
And COVID infection causes a lot of what we call reactive oxidative stress. So there's a lot of inflammation of the lungs, inflammation of the blood vessels, and so on. So we want to see what are the supplements that can actually help us in inflammatory processes. What I'm going to mention in the slides after this, they are not all of them double-blind controlled study, meaning that they are not all conducted with the so-called the best scientific research, but they have been used for people with other viral infection, not particularly COVID itself, but it has helped people with other viral conditions and help them to actually recover. And they found that it helps to boost or to stimulate the immune system to fight whatever virus that they may be having. It is important to, as far as possible, slow down the viral load. But now we find that with the Omicron, incubation period is so short, I think you don't really have a lot of time to slow it down, but you can actually do the preventive part of it before you actually get it. And so as we want to look at, first of all, the home remedies, one of the things that is very helpful to strengthen our body and our immune system is to have a healthy food. So if you are quarantined, or even before you are quarantined in your daily life, it will be good for us to be able to choose food that are healthy, those that have a lot of antioxidants in the diet, and particularly the vegetarian, right, vegan sort of a food, where we take a lot of green vegetables, we take a lot of fruits, rather than the animal kingdom, right? So plant kingdom sort of a food will give us a lot of antioxidant. And if I'm down with COVID, the antioxidants will be actually very, very helpful for me to decrease inflammatory response. Adequate water intake is very important. A lot of times when we're having high fever, when we're having nasal congestion, a lot of fluid actually lost. We're sweating, we lost a lot of fluid. So it is important for us to have adequate water intake during that time when you're quarantined, all right? One of the hydrotherapy, simple one that is useful is a steam inhalation, especially you find that people with this Omicron may have symptoms of blocked nose, running nose, and so on. So steam inhalation is very simple. It can help to decrease congestion. Of course, most of the time when a person is having COVID, they are more or less isolated in a room that has their own toilet, etc. But if somebody may not be having that facilities, then it will be a bit more challenging, right? So when you come out, you will need to wear masks. Gargling is actually very important, all right? Sunlight will be very helpful. If your room is able to have sun coming in, especially the infrared spectrum, which is about 800 and 680 nanometer wavelength, it helps to produce what we call intrinsic melatonin inside the mitochondria. Just imagine that the mitochondria, because of the inflammatory condition that we are exposed to, we need something to so-called cool down or to decrease the inflammation that is happening inside the cell. And exposure to near infrared, right, helps in the production of melatonin. Melatonin is actually an antioxidant. Just like I've mentioned earlier here, we have antioxidants as in the diet. It helps decrease inflammatory condition that's going on in the body because of the viral infection. So if you have your own toilet and you're able to do a hot and cold exposure, right? In this study, they found that if we have a hot exposure before a cold, yeah, so you have a hot exposure before a cold, it has immunostimulating effect. So one of the simple things that you can actually do is you can have a hot shower, right? Turn on the heat to the maximum, and shower under it for about 5 minutes. Then you turn off the heater, and that's where you get your cold. Of course, our cold is not really the coldest for about a minute. And then you turn on the heater again to 5 minutes and then off to 1 minute. So you do it about 3 to 4 sets. So this is actually will be good to help you to stimulate your immune system, to help you to be able to boost it up to fight against the virus. Another one that has been found to be very useful is what we call the whole body hypothermia. Now, this whole body hypothermia has been very effective to stimulate the monocyte, right? To stimulate the monocyte. And here we find that when a person were to do the whole body hypothermia, the human monocyte here, right, will be stimulated. And we said just now that the monocyte and the natural killer cells are the ones that so-called specifically handle the virus. So a full body hypothermia is actually very important. But because of the fact that most of the time when a person has COVID, they are isolated in their own bathrooms, to do a whole body hypothermia is a little bit risky, because if you do not do it well and you do not know what the side effects are, you may have a heat stroke, then you may be drowned, right? So this is more so for, this is recommended for people to build up their immune system when you do not have any COVID, all right? So you can do it on and off to stimulate your immune system. But if you have a COVID and you are alone in the room and you want to do it, then it is not recommended, all right? So remember that. So here we find that the conclusion of the whole body hypothermia, it says it increased the natural killer cell activity, right? And also the monocyte activity. So we can see here that if you have your own toilet, then you can do some simple hydrotherapy. Now, what are the supplements that is useful to help a person with COVID when you're under quarantine? Vitamin C is easily available. It is pretty cheap. And if we would want to supplement with vitamin C, preferable to choose the one that has salt. So vitamin C is ascorbic acid. So if I were to take ascorbic acid as ascorbic acid, then it will not be very good for the stomach. Some people may not be able to tolerate it. But if I were to take it as sodium ascorbate, the salt of vitamin C, then it will be easier for my tummy to tolerate this dose, okay? So studies have found that oral dose recommended from 1 to 3 grams a day, it is helpful to boost the immune system. So why do we want to use vitamin C? Because in this meta-analysis, what is the meta-analysis? Meta-analysis is that they've analyzed many research studies. And after analyzing many of these research studies that uses vitamin C, they found that vitamin C can actually shorten the viral infection, right? Whether it be COVID or some other viral infection. And especially here, in this study, they found that if they were to give vitamin C to people in the ICU, it can actually shorten their length of stay. And here it says that the length of stay in the ICU, right, can be shortened by 8.6%, right? So we find that vitamin C is actually very useful, and it is actually very cheap, okay? Here, vitamin C costs only pennies per gram, whereas 1 day in the ICU costs thousands of dollars, yeah? So, and in this study, they gave to the people only 2 grams a day. So if you go to the pharmacy, probably you can find many different dosages and preparation of vitamin C. Some come as 1,000 milligram, which is 1 gram. Some come as 500 milligram. But remember that we do not really need very, very high dose. If you were to take an excessive dose of vitamin C, like for example, 6 grams a day, then you probably end up having diarrhea. Okay, so we are only saying here that it's about 1 to 3 grams a day, right? So here again, we see that this is the protective role of vitamin C in the management of COVID-19. Now, do you really have to take a supplement? You may not. If you are able to have a lot of fruits, a lot of vegetables, at the same time, that's rich in vitamin C, the natural form of vitamin C that is found in your foodstuff, then that will actually be very helpful too. But if you are laden up with COVID, you may need an additional dose of vitamin C from the supplements. All right. So from this slide, you can see that when the blood vessels is enriched with vitamin C, let me say from your supplementation or from your food, it actually helps your neutrophil, right, in killing off and in decreasing the inflammation that is present from the COVID infection. All right. So here, decreased levels of vitamin C have been observed in different viral infections, such as sepsis and so on. So you find that people who do not have enough fruits and vegetables in their diet, right, have a higher risk of having viral infection. You probably have it in your own experience that when you have a common cold, when you're running nose, and some of your friends will say, see, take vitamin C. And when you take vitamin C and you find that, wow, you feel very much better after that, right? So here we find that vitamin C is actually accumulated in your macrophages, right? Vitamin C influences the various pathways of the immunity, right? And the next thing that we want to mention is vitamin D, right? So vitamin D, if we want to take it as a supplement, it will be vitamin D3, right, or cholecalciferol. And the amount to take is 2,500 international unit. You find that if you were to buy the product, you can see that sometimes in the product, they will write down there as 5,000 international unit, which is equivalent to about 62.5 times 2 will give you how much? About 125. Am I right? Yeah. So a 5,000 international unit is about 125 microgram of vitamin D. So why is it that this supplementation of vitamin D is important? It is found that people who have low vitamin D usually succumb to disease and even infection, more common. And in this study in the British Medical Journal, they found that vitamin D supplementation can prevent acute respiratory tract infection. So COVID is one of the respiratory tract infection. Though this study doesn't specifically mention that it is related to COVID, like I mentioned earlier, some of studies didn't exactly say that it's related to COVID, but yet we know that in general, right, for acute respiratory infection, vitamin D supplementation can actually be useful. So here, looking into the journal, it says that it helps to prevent acute respiratory tract infection. And then they did many meta-analysis. We already say that this is the meta-analysis. Meta-analysis means, as I explained earlier, that they combine all the many different studies that has to do with vitamin D and see whether they have any effect to help people with viral infection. And they found that this is the line, right? This is a line here, which is so-called a neutral line. And you can see that it is shifted towards the left. So which means that it actually, like what the title says, right, to prevent and help in people who have acute respiratory tract infection. So the conclusion, it says here that overall protective effect of vitamin D supplementation against acute respiratory tract infection. All right. So in India, there is what we call the SHADE study. Now, this is more interesting because in this study, they actually give very, very, very high dose vitamin D. And with that very, very high dose vitamin D, right, to build the blood vitamin D level to more than this amount, they found that the outcome of the patient, right, with COVID actually increased. In other words, they recover, right? They are better, right? And it helps to decrease the inflammation that is present in them, all right? One more supplement is what we call NAC. If you were to get it, then the dosage to take it is 600 milligram twice a day. So what is the function of NAC? NAC actually helps in the facilitating the function of your glutathione. So some of you may have heard of glutathione. It is actually something that is needed by the liver to so-called detox, maybe you can put it in inverted comma, toxins, right? So they found that NAC, right, can attenuate influenza-like symptoms and improve the cell-mediated immunity, right? So if you were to take NAC, it can help to improve your innate immune system. It can also help to decrease the symptoms of influenza, right? Now, note that this study is not related to COVID, all right? It is talking about influenza, but generally, you can find that it is probably helpful, right, for people who have COVID too, right? So here, they found that they were randomized to receive either the placebo or the NAC, 600 milligram twice a day for 6 months. And they found that NAC was well tolerated and significant decrease in the frequency of influenza, length and time that they need to confine to the bed. All right, so here it is actually very useful. So if you want to take NAC, you can take it as a preventive thing, right? But here they find that they are taking it for 6 months. Another thing is zinc, right? So it looks like there's so many things they can actually take, right? So another important element is zinc, and zinc come in many different preparation, and a common is zinc picolate, I think. But what we want to see is that we do not want to take more than 50 milligram of elemental zinc, all right? So recommended dose is about 40 milligram a day. Now, one of the important things with zinc is that zinc is actually not really so-called, maybe use the word absorb into the cell, all right? But it needs what we call a carrier or ionopore, all right? So here we find that when the virus, right, the COVID virus gets into the cell through the receptor site, it gets in and it goes to so-called replicate its own genome. It uses the body, right, to make its own RNA. So it's like hijacking the body to make its own RNA. So there's something that is called the RNA polymerase activity, right? So this is just imagine that it is like information, all right, that is on a chain, and the virus needs this chain to be able to make its own viral chain. So if this particular RNA polymerase activity is deactivated, then you find that the virus will not be able to make its own chain, and the viral replication will be less, right? So they found that zinc intrinsically inside the cell blocks this particular enzyme, and because it blocks the enzyme, then it cannot replicate and make its own baby, so-called, and the viral activity will be less, right? But like I said earlier, if I were to take zinc orally, the zinc that is in my bloodstream may not be able to enter into the cell. So what do I need? I need a carrier. So that's why you find that zinc comes as zinc ionophores. So one of the things that they have found that is able, one preparation of zinc that is able to help to be a carrier, right, is pyridiform, but here we may not be able to get it. So if you are going to buy a zinc, right, then buy a zinc ascorbate preparation, right, because zinc ascorbate is, in this study, it says as the best zinc ionophore. So the zinc together with, in this preparation, acts like a carrier mechanism to carry the zinc from the outside to the inside of the cell. And once the zinc is inside the cell, right, it is able to block this enzyme activity. And so when it blocks the enzyme activity, then the virus cannot make its own genome, right, its own gene, so-called, own RNA gene. And so you find that the virus cannot multiply. I hope you understand what I'm trying to say. All right. Now, so here we can see that zinc can also or could also inhibit, right, the COVID-19, the virus, SARS-CoV-2. All right. Here, the conclusion tells us that it does. Right now, when we talk about zinc ionophore, one of the other supplement that I want to mention is what we call quercetin. Right now, quercetin is actually acts like a carrier for the zinc to bring it inside. So that's why you'll find that some people, when they're taking zinc as a supplement, they are also told to take quercetin. All right. So here we find that quercetin is a zinc ionophore, has zinc ionophore activity. So if you're taking quercetin, you can take it as 500 milligram twice a day. Now, there are natural sources of quercetin too, all right? So let's look at this study first in India, right? This study shows that antiviral significance and possible COVID-19 integrative consideration. So here they found that if a person were to take quercetin with vitamin C, vitamin D, and also zinc, right, they are able to help having the synergistic antiviral action, right? So, okay, here quercetin displays a broad range of antiviral property. Okay, I will not read everything. I just highlight the things because we don't have time to talk about everything. And as I said earlier, you can find quercetin in many natural foodstuff. So the one that is pretty high is the onion. Okay, which part of the onion? The skin of the onion, right? So the outer covering of the onion. So if you find that the onion is really very dirty on the skin, you might need to just take out some of it and wash the rest of it. So you have kale, you have cherry tomatoes, you have broccoli that will give you quercetin. And this is a table to tell you how much quercetin is actually present in all the different foodstuff. All right. This capers, I show you a picture here. I don't see this in Malaysia, but they have it in Philippines. They call it, there's a Tagalog name for this foodstuff, all right? But it is very high, 233 milligram per 100 gram of capers. But the one that we can get locally is the onions, all right? If you, in your quarantine time, were to take a lot of onions and you smell like onion, right? It will be very helpful. At the same time, there are some other food items here that can give you the quercetin that is needed. Other things that are useful is garlic will help to build up your immune system. Omega-3 oil that you find in your flaxseed and your chia seed, these are all helpful in decreasing the immunity, in inflammation, right? So just now the question was asked that if you're in a quarantine, what are some of the home remedies that you can actually do, right? What are the treatments that you can actually do to ease the symptom? and to speed up the recovery process. So I've mentioned just now simple things like the hydrotherapy and some of the supplements that you can take, and also the antioxidant food that you can actually consume to help you.
Okay, thank you, Dr. Lee, so much for your such an informative, informations that you have given to us in one straight pack
with evidence. So we talk about vitamin C, we talk about zinc,
we talk about the natural remedies, hydrotherapy that we can be done. Yeah, so thank you, Dr. Lee, for telling us, how we can use natural remedies in dealing with these different situations. And so if you are interested and you want to learn more about natural remedies and lifestyle changes and understand your health condition better and learn healthy cooking, you can join our ANAN online class. We will put the link below, and so you can see. And besides that, we also have a training school right here in ANAN offering medical missionary training, basically to prepare our youth today with the Bible and health knowledge, skills and tools to be effective soul winners. So for more information, you can contact me, myself, Elwina. My email and contact will be also at, down at the text box below. So you can copy the link for both ANAN online class and also for the medical missionary school information. So let's take a short break, and so we will watch the medical missionary video.
And after that, we'll come back for the Q&A session. Have a break, everyone.
Hi, my name is Peter, and I am a person that are uncertain concerning my future. Neither do I have any plan in my life. I have no idea what should I do, but where can I go?
Hello, my name is Loria. After graduated from pharmacy school, I wanted to know the difference between natural remedies and the use of medications. But where can I learn the natural ways of healing?
Hi, my name is Joella. I have been born and raised a Seventh-day Adventist, but yet I feel that I don't know God in a personal way. Where can I go to learn more about God?
Hi, my name is Jerome. At the back then, I was addicted with video games. I can play hours to hours, non-stop, and for few days I did not sleep. Even I come to a point because of video games, I can lose control of myself, of my temper. What should I do to help me to stop this addiction?
Are you having the same problem in your life? We are here to help you. ANAN Training Center is a place to prepare a group of people for the return of Jesus Christ through gospel and medical missionary work. We focus on the total man and equipping them through health ministry, food service ministry, agriculture, work education, maintaining a strong commitment to the methods, principles espoused by the Bible and the spirit of prophecy. This helps to build their character, self-sustain, and able to deal with people, mentally, physically, and spiritually.
ANAN is the place. Here, the syllabus are conducted in a way that I can understand what natural remedies can do to human body. And under doctor supervisions, hydrotherapy, herbs, nutrition are given to minimize the use of drugs.
In the very first chapter, Ellen White wrote that Jesus did not consider heaven a place to be won while we were lost, and that he was treated as we deserved so that we could be treated as he deserved. I was really amazed when I read those sentences at how a great God could love someone like me so much.
But one thing that really changed my life and stopped this addiction is having a relationship with God. Out of His love, God led me to spend time with Him and come to know Him. This not only took away my desire of playing video games, but it has changed my entire life.
And this is a place where I could grow. This is a place where I learn more about God and where my character is developed. And this is a place that I found my life to be meaningful. And I can use my talent, I can use my skill to serve and to share with others about the good news of heaven.
At that moment, it was a turning point for me. I asked God to teach me, to show me about His love and character, and to fill me with His Holy Spirit. And God is faithful because daily He has been teaching me more and more about His character. And I praise God to say that by His grace, the God I serve is no longer the God of my parents, but He is my God as well.
We welcome you to Aiden Training Center.
I welcome you to join Aiden Training Center.
Come and join us at Aiden Training Center.
Come and join us. God is calling once again for Christ-centered educational principles with high Christian standards to train true followers of Jesus in the last generation for soul-winning and self-sacrificing service.
Same as eating, drinking can cause illnesses or heal them. There are certain drinks that help improve health, keeping our body free from toxins. Discover healthy juices. Dr. George D. Pamplona Rogers' latest book, A Practical Guide to Juices, Infusions, and Other Drinks. More than 300 pages of information about drinks that can prevent or heal diseases. Different types of drinks are analyzed in the book. Water, juices, shakes, vegetable milk, non-alcoholic cocktails. It includes detrimental and inconvenient drinks as dairy milk, sodas, coffee, tea, mate, alcoholic drinks. Dr. Pamplona informs about drinks recommended for preventing and treating disorders of different body organs and systems. Vision loss, anxiety, hypertension, anemia, heartburn, cellulite. In addition, it includes practical advice on how to lose weight on a juice diet, eliminating any health risks, how to do a detox or cleansing cure for disorders like cholesterol, aging, allergies, depression, diabetes, breast and prostate cancer. Healthy Juices contains recipes, including information on the properties, benefits, and nutritional value of each ingredient. It is a book of excellent quality, with a modern design and colorful images, which make it attractive and very practical when preparing the drinks. A book that promotes the most important thing in your life: health, ideal for sharing with the whole family and putting it into practice. For more information, access www.safealise.com.
Advertisements on you talk about Alvina just talk about an online class. So if you want to know more, some of the topics that we covered is also in that website. So you can go and click in and go and see. And of course, we talk about the medical missionary school. If you are young, you have children, if you're somebody that you know, they just freshly graduated from SPM high school, then they also can come and to learn and expose themselves on medical missionary field. So, and the last thing that we saw just now is an amazing book. It's a book talk about juicing, about how to treat certain diseases using juice. Okay, it's very interesting. If you find it very interesting, you want to know more, and you want to get this very unique and interesting, a lot of graphic. Okay, as you have seen from the video just now, you can contact the ABC bookstore. I think Dr. Pua, maybe you can put in the contact number of the person. Then you can go and buy the book and go and learn. If you do not know how and you think that it's too complicated, of course, you can come and join us in ANN Healthcare for program. The book just now is 175 ringgit. So you can contact your local church pastor, or you also can, find out the ABC contact person. So Dr. Paul, maybe you can help us to put in the contact. All right, so let's see some of the questions we had in to the, and one last thing, we want to also let you know that on the 29th of May, we have our next talk by Dr. Isaac. You can see the poster here. Yes, the next talk is Heart to Heart Talk. Okay, is from Dr. Chan Enzi. Okay, he's an amazing doctor. He talk about the heart. So if you have interest or somebody that you think might be interested in, so you can go and access to it on the 29th of May. Okay, so please go and put it in your calendar, note it down, jot it down, 4:30 to 5:30. Okay, make sure you don't miss that. All right, so now we go and head into our Q&A session. We have a few questions we can see from the chat box. Okay.
Any questions that you haven't put in, you can also put it now into the chat box, and we will have, both doctors to answer to our questions. You can ask, Dr. Lai, and also you can ask any lifestyle questions from Dr. Lee. So we will ask our first question, Dr. Lai. Here it says that, what's your advice for second booster? Is it really needed?
Okay, the booster which we had, the third jab was the first booster. The second booster, actually, they are when you hear about it, actually just needed. I would think. I mean, you can't keep on doing jab indefinitely, right? So there are people who, even any jab, any vaccine in the past has only elicit very weak immune response, like people who are age older than 60, and their bone marrow is not able to make the armies, make the antibodies so much. If you give any vaccine, the raise in the antibody titer, it might not be so high, even in other vaccines. So and they have some comorbidity, chronic condition, and some condition are actually immunocompromised. They will not respond. Even the T cell might not respond. Some of them have been taking some medication to suppress their the immune system. So those people, if they get COVID, also quite catastrophic. So they might want to protect this group. So this specific group people, they will be given optional. It's not mandatory. It's a small group of people. I mean, of course, they can't stay at home all the time, shelter, but yet we want to resume normal activity. Maybe there's a calculation. The benefit is higher than the risk. They will get that. And with Israel and US has been going on, like they're given a second booster. But we see how they're doing. I mean, it's not a thing to go all the way, because vaccine or booster is just one arm of the defense. I mean, this is internal defense, external defense, the mask and all the shield. But you have other arm, that's your robust health. That's your other the body upkeep and the status of your health. There any other health issues. If you like, the principle that you live by, the New Start principle, and the general health will mean a defense which is more constant, because you need a team to your body. It's actually a teamwork. You cannot just simulate certain part of it. Hopefully, it will do all the work to defense. You cannot only run on good cook. You also have a good therapist. You cannot just boost the therapist and forget about the cook. The people will complain, right? So same thing. So it's a kind of symphony orchestra. So you cannot just hope for booster, and then after that booster, I mean, you whatever name you call it, it's just boosting something that may not do all the work. Yeah, you have to be realistic about it.
Mm-hmm. Yes, we cannot just boost the.
Totally depend on the booster. Both things works together. So our lifestyle plays a very important role too. Yeah.
All right, we see the other question that we have on the chat. It says that if after COVID vaccination and you have discovered you have painful spots, flare up that is still there after a few months, should you continue to go for the booster shot? And yes, Singapore and Malaysia somehow is almost the same. We probably will go for restrictions if we didn't get the booster. So just wondering if what is your advice?
Okay, we had to find out the person who has been was vaccinated. Does he or she have any allergies to begin with? Because a lot of people, when they have sort of dermatitis, they will have those spot. I mean, the inflammation on the skin allergy, nose allergy, or that generally they have any allergy. Second thing is, some people inadvertently, before their second vaccine, they might have some infection, maybe a slow dose. They did not know it, they did not diagnose it, and when they get a second jab, their body will have certain reaction, sometimes including these rashes. So I think it's better to check it out. I mean, if you meet the doctor to assess, to evaluate, to find out, and then they probably, if it's deemed that it's related and you're not suitable for a booster, probably they will certify, give you a letter to certify that you do not need to go for booster. Because I have patients who have ulcer. I mean, he has a right leg ulcer, right foot ulcer, and then after the jab in July, second jab, his left foot also got ulcer, almost had to amputate the toe. And I have another patient who has vaccine and getting eosinophilic pneumonia. That means she had all the flare up in the lung, something like, some immune cell going to the lung. So of course we had to write letter to tell the authorities, say that you cannot chase these people for booster, because they will end up getting disaster. So we wrote, I think each case, but we cannot just write letter blanket, you just have a little bit of this and that, and then we need to be certified and verified, because then it will be fair. Then we can pick up the real, because some people who they cannot go for mRNA vaccine, they can go for inactivated virus vaccine. So so we have to see case by case basis. Yeah. Hopefully I answer. Yeah.
Yes, thank you.
Now the third question. Here it says that wear mask for a long time, does it affect our health? And this person says that I've noticed breathing my own breath and carbon dioxide, even for 10 minutes, will make me moody. So what's your advice, doctor?
Yeah, I think because we have been wearing for how long? Almost 2 years plus. I think some of the face got a mark there. Like Panda raccoon. I mean, it is a mark lah. Okay, we've gone through it. I mean, that there are people who keep on wearing their mask and their vapor coming. I mean, all the air go into their eye and they develop dry eye sickness. And there are people who are, as you say, they feel that they're breathing back the air. I think it depends on your structure of the face and your nose, because every one of us carry a house in our house, in the sense that the air go through the lobby at the nose, go down into the mouth and then into the throat. So if that structure was narrow to begin with, if your house, the design is not good, that means your upper airway structure, you might have a very narrow back, you might have tonsil very big, side to side very narrow, you might get problem with the mask lah. I mean, they try. My patient not wearing mask at home, they are okay. When they have lung disease, they come to clinic, they have to wear mask. Some of them were quite breathless. They will pull down their mask, that kind of thing. But so would probably some people have obstructive sleep apnea. There are people who are very thick neck and they are a bit more put on weight. If they putting on something in front of their nose and mouth, they might have, because sometimes they open their mouth and breathe, so they will have a lot of problem with that. We can understand that is lah, but you have to try and select. Nowadays you have many fanciful masks which are squarish, triangular, and whatever. As long as it protect you and it doesn't it doesn't pose a lot of rebreathing kind of problem, then it should be okay. Because I mean, just it's a balance. Because if you don't wear mask, of course you will put yourself in the risk, and you wear mask, you feel uncomfortable. So I think you have to get a balance. Nowadays, I think outdoor, even in Singapore, where it's largely an urbanized area, which do not have much of outdoor wilderness like in Malaysia, they also allow not wearing masks. So I think now it's a bit relaxed, but I think we have to tackle those people who feel that they have, I mean, those people feel that difficult wearing masks. They have to find out what is wrong with their structure, you know, at the back of the mouth, and they probably have some sickness to begin with, like sleep disorder, breathing, that kind of thing. Maybe daytime you breathe very hard, and then of course something is in front, you might impair your breathing. But but most of the people will not have any problem. Just some mark on the face, you know, skin, that kind of thing. It's just minor. Yeah.
Probably you only have some skin issues here. They have acne because make sure you take care of the hygiene. If you are allergic with the material of the mask, maybe you can change to other kinds of materials. Nowadays we have so many options, like what doctor said. All right. Any more question we can see from here? No? Okay. So maybe you can ask another question about lifestyle and natural remedies. Dr. Lee. Okay. We want to ask about, we heard about exercise. Okay. Any, we need to exercise also, right? Sometimes any of the exercise you think is helpful for respiratory recovery? Because just now Dr. Lai saying that we probably have a long COVID, right? And then we're going to injure our lungs. So any good exercise can help us.
Yes. Let me just show you some picture as to because it will be a bit more difficult to explain. Can you see my slide?
Yes.
All right, let me just adjust it a little bit. All right, what are some of the respiratory exercises that you can actually do, right? If you are feeling breathless, one of the things that help you will be, you can either sit like this man, how he's doing it, or if you need to lie on the side, then you can lie like this. It will help you to be able to breathe better. All right. If you are sitting, then sit like this. If you're standing forward, do like this, right? So these are some of the ways. A lot of times we are shallow breathers. So one of the way to help us to be able to have better air intake is to use what we call diaphragmatic breathing. Okay. Now, one of the way to help to relieve cough, maybe now with people with Omicron, you might not be coughing as much as a person that had Delta before. But this is what we call pursed lip breathing. So you sit in front, right, and you breathe, right, through your nose, and you breathe out through your pursed lip mouth. And you relax, and your breathing in and out is a ratio of 1:2. So in other words, you breathe in, but when you breathe out, the time taken to breathe out is 2 times longer than breathing in, right? So you just repeat it a few times. So this can help to actually relieve people that have cough. So when you're doing that, we call it the breathing in a rectangle. So you look at your door, right? You have a door. So from this corner to this corner, you breathe in. Then from this corner to this corner, you breathe out. So can you see that the time breathing in is 1 to roughly about 2 ratio. Then from this corner to breathe in again. And from this corner, you breathe out. So these are some of the breathing techniques that you can actually use to help. If you have phlegm, what you can do is what we call the huffing technique. So you can actually see this lady here. He is actually doing what we call a huffing cough to force whatever sputum that may be present there. And he performs it, right? So you perform in a sequence of 23 deep breaths and 12 huffs. So you dip in, deep breath, 23 times, then you huff. Huff is just like you're coughing out whatever COVID that you have. Like this, okay? Just like you got a choke. So that's how you do what we call huff cough, right? So you can have a small to long half, or you have a big to short half. So whatever it is, right, you can do a half cough, and that will help you. All right. So hot and cold fermentation is useful. If you are able to do it, it will help you to be able to cough out whatever sputum that will be present there. Okay, I think postural drainage if you can. All right, I think that's about all. Pass the time back to how do I take it off now? Okay, Sinro, back to you. I don't know how, okay, stop the sharing. All right, thank you.
Okay, interesting. 23 deep breathing and 2 half. Maybe you all can try doing anytime. 2 half, right? 12.
12 halves. 12.
Okay, maybe you can start practicing after the talk. Okay.
Someone actually asked a question here, private direct message, to how to do the what do you call it, full body hypothermia. I just answered a message direct to the person that if you have not done it before, then it's preferably not to do it, because you can end up having a heat stroke or spasm in your limbs. Do the hot and cold shower, do the steam inhalation.
Right. If you want to know how to do the steam inhalation and hot and cold shower, same like just now, you can go to our ANAN class. Okay, there's demonstrations and also methods, procedure that you can follow through, and you will know how to do it. Now, another question for Dr. Lee. Dr. Lee, so since we say that we enter, okay, Malaysia enter this endemic phase. So basically, we are living with the virus. Is there anything that we can do to prevent ourselves, from getting COVID or to boost up our immune system?
Yes, some of the things that I've mentioned just now. If we were to put it in an acronym, right? How to boost, how to strengthen your immune system, then we will spell it as strength for the immune system. So STRENGTH. So if you count the letters, STRENGTH, how many are there?
8.
8. So what is the first S? The first S is sunshine. So we mentioned earlier that sunshine is actually very important, more so especially the COVID, because it will help to produce the intrinsic melatonin in the mitochondria, which helps to neutralize the ROS, the reactive oxidative species of stress that is present. So that's the first S. The second one is T, which is temperance. Temperance in all things. Sleep is very important, right? Sleep early, sleep adequately. Try to avoid the things that will bring down your immune system, like the food that has high sugar content inside, right? Try to avoid refined food and so on. So STR, rest is very important. So sleep early, at least 7 hours of rest per night. And that rest also includes digital rest, because a lot of times we have all the WhatsApp messages, all the videos, and all the things from electronic that we don't have time to actually rest. So the next one is E, which is exercise. In the US, they recommend 115 minutes of moderate intensity exercises a week. So if I'm going for 5 days of exercise, 115 minutes divided by 5 will be 30 minutes every day. Right? So 30 minutes every day, moderate intensity. That will be a very good booster for your immune system. The next one will be N, nutrition. We mentioned about it earlier, right? So we said that food from the plant base is preferable, high antioxidant, right? Especially food that has high antioxidants are the berries, those that has many different colored sort of fruits. Garlic, the onion family, the cruciferous vegetables are very good. So we have STRENG. What is G? Good, fresh water, right? A lot of times we are drinking beverages, so we need to have good, clean water, put it that way. Then we have T, which is trust in God, right? A lot of times we are having a lot of fear, we have a lot of unrest, we have a lot of anger, we have a lot of emotions, right? Trust, to learn to let go and let God take charge of all things. And we have H, the last one, which is heaven is fresh air. So the air in Aden is very fresh. It's raining now, right? So the air is very fresh. So go to a place in which you have a lot of negative ions. That will be very helpful. So as you think of strength, these are the 8 principles of health that will boost your immune system.
Thank you, Dr. Lee, for sharing with us a complete package again about 8 things that we need to do. Strength. So we're gonna ask again, Dr. Lai. We recently have a lot of people also recommend to us about using the mask, and then we have some essential oil that we can put in, or the zinc. Zinc? I don't know lah. Like something to prevent ourselves from the viruses. Will it affect our body if we every day using it?
I'm not sure what are those. Maybe there are people who, you probably have to see whether it's really helping. I mean, because you are breathing in something every day, we are not sure whether if you breathe in something occasionally, I think it's quite okay. But basically, the function of mask is to block off unwanted noxious particle, including, it depends on its N95 or something lower. But if you are allowing something to go in, unless you are sure that substance is harmless, we cannot be very sure what because some people may be sensitive to certain fragrance, certain things, and we will not recommend it for long term. I mean, it is like the temperate, something temperate. I think we have to avoid preoccupation, sort of just thinking that will do. And then, as I say, the endemic, moving to endemic is actually you're looking at the lives to get back to normal and you want to open economic activity, but you see this as a virus sort of getting better in a sense, better. Human beings need not to get worse. You should be considerate to others. You will help the weak and the vulnerable. You shouldn't promote something which is partial and some fake information, or you promote something for your gain, your profit. The virus is getting better in a sense, very better. Human nature might be the same, but we should be better as well. We should, post-pandemic, we should take care of ourselves well, our health, take care of others, and help those who are weak and vulnerable, rather than if you want to capitulate on certain thing, ask people to buy certain thing which is no evidence or which might be harmful. So just for your profit. Sometimes it's just a trend, some people want to use. I mean, you get all kind of fanciful masks. Of course, the mask, the important thing is to get back to basic. What are the filtration and what, because a lot of things at the end of the day is just, hopefully this thing will pass. The hope is that this season will pass. But I mean, something that you buy or something you subscribe to must be an eternal value, must be something that lasts long. It's just not just after a while the fashion change, that kind of thing.
Yeah, there's something people say that there's no one particular cure that can solve all problems. We all have to learn how to, have to face the reality that you need to go to exercise. You need to make sure you eat well, right? All these things will be more like a holistic kind of treatment that you need. There's not like booster can't really like the solution for everything. So just have to be wise in making our decisions. Okay, thank you so much, Dr. Lai, Dr. Lee. I know that if you have further questions, you are very paiseh to ask, then you can just go and type to them.
One question, please. It's to Dr. Lai.
Okay.
Now, do you mean to say the previous COVID virus has waned off And then now we are dealing with the evolvement of the virus, the variant. And it looks like it's a better, shorter fight against this virus. Is it?
Okay, viruses, including all the previous influenza viruses and all the other viruses, actually constantly changing. Just that wasn't sort of put into limelight, spotlight, and wasn't like studied so detailed, like the new virus now. So they will keep on changing because in the person body, because they go into our body, actually emit resistance and it can mutate, it can shift antigenic drift and shift. So actually, that's why the influenza virus vaccine had to change every year, different strain, different things. So for this COVID virus, also the same thing. But because it's so heavily sort of tracked, so sort of there are many unknown ones. So I don't think the Greek alphabet can contain, but some are not significant. Some happen that this one because it's transmitting so fast. Hopefully, it took over most the other strain. So hopefully it is that way, God's mercy that it is that way. But we cannot say it's very mild. It's still mild. I think it's still more serious than the influenza. As I say, the fatality rate of the influenza is 0.1%. This Omicron strain is 0.75. So I think for certain people, it is still quite deadly. But when the number is high, it can incapacitate the health system. So hopefully it would, let's say it depends on how you wanted it. And if it's something controlled by human being, of course, we will say, oh, we get a very perfect vaccine and finish it off. I don't think so. We cannot overcome what nature, I think God's ability is even better. So maybe this is a way that to tone down the pandemic, probably is a blessing in disguise. But of course, we do not want to expose ourselves because there's some long COVID issue and all this. Yeah, hopefully this stopping there. Maybe there's some new variant, but it's not so deadly than the previous one.
Any more questions from the floor?
You can unmute yourself if you want to ask any questions.
Yeah. Presently, what I saw in the video happening in China, the Omicron are really making a very big impact on the population. So if it ever happened to Malaysia, how are we going to deal with it? Thank you.
Yeah, China have a lot of elderly people who has not been vaccinated as well. And then they have some other issues because I think they have been less children to look after them because the population policy. So this is unique to their society. So of course they wanted to be dynamic zero policy. So they of course they were straining their health services at one time. They all happening. Yeah. Hopefully they will come out of it.
More question? Any last word from our doctors?
Yes, I have a question for Dr. Lai.
Okay.
Pastor Sibon here. Yes, Dr. Lai, remember me?
No see. Yeah.
Yes. Nice to see you.
Where are you now?
I have a question. In Miri, Sarawak.
Okay, good.
Yeah, I'm jogging now. I know you're not a pastor, but I'm a pastor. So ask the question as a pastor. My question is, should we Adventists, what we think about booster all the time in a spiritual way? Can we take or not?
Okay, I think the vaccine probably if you have completed the 2 doses and because people just when they do a study, it's like across the whole population. So everybody may be different. But so sometimes people, for certain reason, they do not want to take booster. I think it is not a compulsory thing. Just that make sure they have other line of defense, because we cannot keep on using the same tool. I don't think you can boost all the time. Even if you are boosting, you are using the same strain of virus, just like the Sinovac, they're using the ancestor strain, the Wuhan one. So when the virus changing, even you boost the old type, also it might not help that much. It's just a false sense of security. But do not forgo other part of defense rather than, when we say we do want booster, but we do not take care of other things. Of course, the outer defense, we have to worry. And hopefully as the virus come down, hopefully lah, is healed, then we no need to be preoccupied, obsessed with so many things that is only one track thinking. One track thinking meaning you only thought about that method only you have to do, because I think everybody is different. So we cannot always think we can only win this pandemic by booster lah. It may be other thing we need to use. Maybe God will use other way that we have not imagined. Yeah.
Thank you, Doctor.
Thank you, Sibon.
Bye, Sibon.
I know. See. Yeah.
Okay. Any last question from the floor? If not, then probably our doctors here want to say any last message from the people that joining us on today. Tell us about your idea, your advice you can give to us.
Come to ANN to learn, and also to what do you call that? To boost to. I think booster is not for vaccine only lah. You need to boost your morale. A lot of people are mentally taken a toll lah. I think mental health lah. Some people burn out, some people fatigue, and then we can't bear to pick on somebody about the mask, about the booster. I mean, sometimes we get easily angered because of this. We feel that there's a frustration that not able to overcome a small thing. When God created us, He asked a dominion on all the animals, but seem to be we become more like animals, and this virus is upsetting us. So I think other thing, if you're a healthy body, you got healthy mind. Of course, not only ANN, but of course you have to do your homework. Before you have to boost yourself every day lah. Check yourself every day. Not only when you meet that, then you only think of burning the midnight oil. Yeah, thank you.
Tony?
Yeah, what Dr. Lai said is very, very important, because a lot of times we are trying to treat ourselves when we have a disease, but we don't prevent ourselves from getting a disease. So that's why we find that lifestyle is very important. If we cannot come to ANN, then probably we can still embark on the on-site online learning.
Okay, we didn't pay them to ask us to promote ANN. But okay, thank you so much, doctors, for sharing such a very informative information about COVID and how can we deal with this. And thank you so much for joining us until the end. We will hope that you can also join the next talk that is on the 29th of May by Dr. Chan about heart-to-heart talk. Okay, heart-to-heart talk about heart issues. So thank you so much. Before we end this, thank you so much, doctors. Okay, before we end this, we have a video to show to you, and we'll come back here for closing prayer.
Did you know that each year, 60% of all deaths in the world are due to lifestyle diseases?
But the good news is it is preventable and reversible.
Well, this is why we are here to assist, educate, and empower you.
We have a full lineup of healthcare professionals and experienced leaders who specialize in wellness and lifestyle healing.
They will be sharing with you a wealth of amazing tips on how to obtain better health, as well as prevention strategies that will help you to live the life of happiness you want.
You will not only be given facts, but you will be inspired and impacted by the real-life experience from people who have gone through what you or someone you care have gone through, sharing stories that's safe.
If you want to experience an enriching, happy, healthy lifestyle, you would want to experience
the ANN Podcast.
Okay, all right. Thank you so much. Can we have Alvina to close this session?
Okay,
with a prayer.
Let's close out with a prayer. Our gracious Heavenly Father in heaven, we're so thankful, Father, that you have given us this time and opportunity, that we have Dr. Lai and also Dr. Lee to share with us a very informative information. And I pray that, Father, that you help each and every one of us as we enter this endemic, that we will not forget to also to take care of our body through our lifestyle, and we commit ourselves into your hand, that you watch over us and also be with every one of us here too, that you bless us, and we pray all in Jesus' name. Amen.
Amen. Thank you so much for joining.
Bye.
Take care. Thank you, doctors.
Yeah.
Take care.
Bye-bye, Dr. Lai.
Bye.
Bye-bye, Dr. Lee.
Bye-bye. Take care.
Bye-bye.
Bye. Please, Yvonne.
Yeah. Take care. Come to Sarawak next time, Come over.
Thank you, everyone. Thank you, and bye-bye.
Bye-bye.
Yeah.
Thank you. Bye. Thank you everyone for joining.